You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.
Hey guys, welcome into another episode of Plastic Surgery Uncensored. So today's episode called is Smoke and Mirrors. I am accompanied by my dear friend Melinda, the beauty broker from New York. Listen in so we can talk about sort of all the misrepresentations. You know, this is a huge topic for me about how to figure out who's your right doctor to do what. So listen into the next episode. I'm sure you're going to love it. Hey guys, welcome to another episode of Plastic Surgery Uncensored. I'm super excited. I'm here with my dear friend Melinda from New York. She's known as the beauty broker, but she is an aesthetic consultant and patient safety advocate. She's joining me today. We're going to be doing a series of shows, and this one I'm super excited about because you know this is a big topic for me, which is the whole idea of, so I'm a patient and I'm trying to figure out my way through the world, and I get online and I put in facelift or rhinoplasty or breast aug, and I'm overwhelmed with options. I mean, there's like 5,000 guys that are world-renowned experts in breast aug. Like, they invented it as if they invented it. And the reality is that we both know, not just from the fact that we've seen so many bad outcomes, but we know from the internal side, from the insider track, that a lot of these people sort of aren't well-trained, aren't who they say they are, aren't necessarily what they seem to portray. So anyways, welcome back.
Thank you for having me. You're the best. Thank you, Roddy.
So tell me, so you consult patients, right? People call you up and say, hey, Melinda, I'm interested in having X, Y, and Z done. And then it's sort of on you and your expertise to help guide them. Of course, you'll ask them all the questions. So tell me about this whole idea of misrepresentation and like, you know, who's your right doctor, who's your wrong doctor? What do you do? What's your process?
I mean, I think what I'm seeing the most of are, you know, people who just give up because they are like so confused, so overwhelmed by what they're seeing out there. It is so difficult to navigate this industry and an industry that is considered the wild, wild west of medicine. So, you know, people I don't know where to go. This one says yes, this one says no. This one says right, this one says wrong. So they're seeing so many contrasting views on social media, and they're really confused, and they don't know what the right or wrong choice for them, you know, for their own case specifications are these days. And when they come to me, they're kind of just like, I need someone to hold my hand because, you know, I have done a couple of procedures and they really didn't turn out right for me. I thought I did my research correctly, and apparently I did not. So I really need an expert to help me, you know, help guide me through this industry.
And I think the interesting thing is, so not everyone, a lot of people know that, you know, my wife had some spine surgery, for example. And when it comes to something like spine surgery or gallbladder or whatever, it's not that confusing, right? You go to a city, there's 4 or 5 hospitals, there's people that are well-known, et cetera. So the question one asks is, why the hell is cosmetic surgery or aesthetic surgery or plastic surgery so confusing? And the reason is because there's all different kinds of people practicing the same thing with different backgrounds and different trainings, which you don't have. I mean, no one's going to be a urologist doing spine surgery, right? But in plastic surgery or in cosmetic surgery or in aesthetic surgery, notice how I use 3 different words to describe the same thing.
Right.
People are overwhelmed because there's a ton of manipulation. There's a ton of misrepresentation. There's a ton of smoke and mirrors. And that overwhelms the patient because they're afraid of making the wrong choice.
Right. Smoke and mirrors, deceptive marketing tactics that a lot of people use to pull in a client for their business. Yes, we see a lot of this. The laymen do not know, you know, how to decipher between a cosmetic surgeon or a plastic surgeon, what their training was, what they had to go through to get to where they are now. So let's talk a little bit about that, because I know you see a ton of this. I know you've probably touched upon this topic before, but not with me. So let's go through this. So what do you tell the patient who came to you from so-and-so who is a cosmetic surgeon who now is in your office with a botched breast augmentation?
So you're absolutely right, because this is one of my sort of talking points that I constantly do. The purpose of the conversation isn't to say that cosmetic surgeons are bad and plastic surgeons are good. That is not the purpose. The purpose is transparency. I say it over and over and over again. If you decide to go get a tummy tuck by an OBGYN who's sick and tired of delivering babies in the middle of the night, went and got some kind of training, albeit some terrible and some good or some, and you know that that doctor was an OBGYN who's fed up and you choose to go there, high five. Good for you. That's awesome. I'm not going to tell you that that guy is worse off than me, who's a board certified plastic surgeon because I went through X, Y, and Z training. That's for you to figure out on your own. Where I get pissed and where I get angry and where I know it's manipulative is when doctors are putting on their websites that I'm a board certified cosmetic surgeon, when we both damn well know that they're board certified in OB and they're choosing to do cosmetics as a profession. And so you should say right on there, I was trained in OBGYN and I have decided to move on to cosmetic surgery. So what I tell them is, listen, I'm obviously biased, right? I, in my opinion, took the sort of the high road. That's an arguable entity, but I chose to go through the plastic surgery residency program. Then I decided to get board certified. And I think that these things, these sort of names and hierarchies, while they're never going to guarantee you an excellent outcome, they're certainly going to increase your probability of a better outcome. And so when you have all these opportunities, we're not in India, in Mumbai, we're in America, and then we're in major cities, and you have access to thousands of physicians. So in my personal opinion, when you can choose between someone who's well-trained and someone whose training is arguable or questionable, I don't really see any reason to go anywhere else unless it is that you don't know any better.
Correct. I also see that even when they do go to a board certified surgeon, and here's, as a consultant, I really try to hone in on niche specialties and what a specific doctor really specializes in. If I send to somebody who does a load of body contouring or breast augmentation or mommy makeover, should that person also, if I refer the person there, should the doctor be also trying to upsell the patient on a facelift or a rhinoplasty? And how do you feel about that?
No, I mean, I think the reality is there's this, so this is a sort of I have a duality on this. I think that a surgeon on his very own should look internally and say, I'm good at the following things, and this is what I'm going to do. And I think that there's a lot of pressure on the marketing side for physicians to specialize. Oh, I only do eyelids. I only do right breasts. I don't do left breasts. It's not my thing. I just stick to the right. And I don't necessarily know that that's the right thing or the wrong thing. I just know that there's a lot of pressure for you to subspecialize because it makes it easier for you to market. People who know me know that I do the gamut, right? I did a facelift yesterday. I love noses, and I do a boatload of body contouring. I think my judgment as to whether or not I'm a specialist or not should be based on my results. You go on there and you're like, oh my God, I want to get a facelift, and I was thinking of doing my breast. If you go on there and you look at my facelift results, and you're like, yeah, then I'm not your guy. But I do think the idea is that unfortunately, guys aren't going to check themselves, right? So for example, I don't do a boatload of liposuction. Why? Not because I'm not good at it. I just don't think it's a great procedure. I don't do certain procedures. I don't do pec implants. I don't do a ton of fat transfer to the butt because I don't think it's a good procedure. So I have internally restricted myself to, as we said before, my lane. Mm-hmm. I think that when you're not busy, you are egocentric, then you'll say, well, I'm great at everything. And you come in and you should know better. You haven't done a lower eyelid since 2012. And this patient is there going, hey, hi, doctor. I always send you to do my breasts. And like, I've also noticed I had some bags under my eyes. And at that point, instead of going, honey, I don't really do under eye bags. My suggestion is that maybe perhaps you should go to my colleague or go back to whoever sent you. I would be shocked if anyone, it takes someone who's really confident and settled and knows themselves. And so, no, absolutely, they should do that. But we both know that doesn't happen.
We see it a lot. And the patient, who we refer to the breast specialist, or in my opinion is the breast specialist, ends up doing their nose with the breast specialist. And I remember when I was 22, 23, sitting with Tom Romo, who does a lot of rhinoplasty in New York City. And Tom said to me, Melinda, if the patient wants their nose to look like a breast, they do, they're doing their nose with the breast guy.
Yeah.
So I'm like, that's true, because usually one of those two things will go wrong if you're not really going to the guy who absolutely specializes in this.
Yeah, and I think, listen, we're very lucky. With the exception of photo manipulation, just take for a moment the argument that the photos that are there are real, okay, which is a topic of its own. Then there should be no way on earth that you should be able to manipulate a patient unless the patient doesn't bother to look. And if you go to a doctor and you're there for his tummy tucks because you did a boatload of research, and then while you're there, you said, oh, by the way, I want to do my nose, and you don't go back and look at his nose work, shame on you. There's no reason in today's world with websites and Instagram that you should be fooled as a physician, again, assuming the photos are not manipulated, because it's there. So whether he markets himself as a rhinoplasty expert and then you go look at, my God, look at these 50 photos. These are terrible. Well, then he's not an expert. I mean, I don't care what he says he did or where he trained.
Or if he only has one photo up, one before and after, or even in his books, like maybe one or two things that he shows you.
Or like a repeat. One thing that I notice, and every once in a while, my wife likes to show me things on Instagram and you're looking at it and you're like, when you see a physician who constantly is reusing the same amazing rhinoplasty, that's a very bad sign. The reality is that if you're an expert and you do a ton of noses, you should be doing excellent work on a regular basis. Therefore, you should constantly be producing new material, and you should not be referring to the lady that you did 3 years ago.
Correct. Also, I see a big issue of that, people only do their research on Instagram when they're looking for specialists. And
Kills me.
I have to say about 60% of the surgeons who I do refer to they have no social media presence. They barely have a website. They're not on Instagram. I find a lot of these guys, through the journals, through the textbooks, through studies, through other physicians or other respected physicians that I work with and specialists who I work with, or, just through the meetings, the panel experts, and just through my, full scope of the industry observation. So it's like, it doesn't begin and end on Instagram or on social media, and people really do need to kind of dig deep to find it, which I think it becomes a useful service, the consulting end of things.
Totally, and I think you hit it on the head. A perfect segue. So this is the deal. When we started the Instagram, it was begrudgingly. It was like, oh my God, another goddamn platform that I need to now be present on. And for a while, I was sort of like, no, I'm not going to do it. And then you realize you just have to have certain presence there. I think there's an interesting, I bet you if they did a study, actually, they've done a few studies. Not, I think they have. There's like an inverse correlation between like the more present your physician is on and the more followers he has and the more sort of shout outs they do, the less credible they are. Because Instagram is one of those platforms that you can create your own false identity. And so, yes, your doctor can use Instagram as yet another tool to display his work and educate people, and maybe you get to know them as a person, so you get to see them with your kids. That's very nice. But it's not a substitute for anything else. And if you have constantly images of your doctor like holding boobs in his hands of a patient, like, check out these things, that's a red flag. The fact that you are able, and this is where I think a consultant is so helpful, is if you as a patient are like, well, I just can't make heads or tails of this. Mm-hmm. I mean, he's got 250,000 followers. I just don't know. Then you need to seek the help of a professional. And the professional is like a consultant, someone like you who says like, listen, this guy, you need to go beyond the sort of outer shell or the costume or the mask they're wearing.
Right.
And, if you can't do it on your own, well, then you need someone to help you. So absolutely, I think that the social media, we have patients. It's so funny. We had a patient call not too long ago, and they call Maggie and they say, does Dr. Bond do breast dogs? And she's like, yeah. What do you mean? She's like, I just don't see that many pictures. And she's like, he has almost 200 photos on his website. What are you talking about? She's like, website? Like on Instagram,
like,
I mean.
That?
And she was like, Instagram? Like he has a www. And then she's like, crazy. So we have to put these things out there because people are actually, they don't even know a website exists. So,
right.
It's a crazy concept.
Right. So when do you feel the need to refer to an actual specialist? Like if a really difficult revision came to you, do you feel the need to like send to so-and-so? And like there are a lot of specialists like revision rhinoplasty, really difficult revision rhinoplasties or reconstructive surgeries. So the difference between the plastic surgeon or the reconstructive surgeon, let's talk about that.
I think it, again, goes back to each person internally. If you're truly humble and know yourself, you know your skill set. You know because you know that based on you should be checking yourself. You should be looking at your results going like, wow, that sucked. Wow, that sucked again. Maybe I'm not good at this. Just like I'm not really good at ice skating. I could ice skate 100,000 more times. I suck. I'm not going to be a hockey player. So you would hope that each doctor was checking themselves. So I personally refer out when I feel another specialist is helpful in adding a skill set that I just don't have. So,
Right.
for example, I had a patient that came in. She came in for diastasis recti, which I believe is something that I do
Very well.
very well. It's my area of expertise. She had a frank hernia, a big old hole in her abdomen. And while I could probably muddle my way through it, and I would probably do a great job, what if it's too large? What if I can't close it? So I would be doing a disservice to patients. So I said to her, I think you need to see Dr. Tofai. Dr. Tofai is one of the world-renowned experts in hernia. I referred her out. When I see a patient, for example, that has a complicated lower eyelid issue, I do lower eyelids, and I know what kind of lower eyelids are within my scope of things. So when I see someone with lax lower eyelids, inverted, scarified, blah, 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 I'll say, you know what? I know these 3 oculoplastic guys that literally morning, noon, and night, they eat, breathe eyelids. So when I see a revision nose, I refer them to myself because I do hundreds of them. So I check myself, but absolutely when I don't feel comfortable and I'm like, you probably should see the Mohs surgeon. I could whack this out of your lower eyelid, but it wouldn't serve you. Whereas the Mohs surgeon's going to kind of go through it and take off the least. And you can come back and I'll reconstruct your lower eyelid, but I don't think you should have me take it off.
So why aren't we seeing this with like the derm and plastic? What are your thoughts on this? Because this is a huge issue right now with a lot of dermatologists doing things that just are not within their scope of expertise rather than referring them to the plastic surgeon. But I know a lot of plastics who will refer a lot of the dermatologic issues to a dermatologist. So let's talk about that because, it's a very, very common conversation that I have with clients every single day. Like, I'm going to go do a bunch of fillers now with my dermatologist, or I want to lift this. And I'm like, dermatologist isn't going to lift you. That's not what dermatologists do. That's a plastic surgeon territory. So I'm very into like the whole territorial thing.
I love
let's
it.
talk
And
about
you know
that.
what we're going to do? We're going to let people think about that, and we're going to come back after break because I love ending the break at a controversial subject. Is he going to come back and talk bad about dermatologists? So we'll be right back to talk about the derm plastics feud.
You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.
So we're back with Plastic Surgery Uncensored with my dear friend Melinda, the beauty broker from New York. By the way, you're doing great because I know you're a little jet lagged. Or you get the extra time this way, right?
I do get the extra time this way. I caught up though. I went to bed last night at like
You're good.
8:30.
Yeah, well, you look fantastic. The Red Bull's
Thanks.
kicking in. So the question you had asked me, which I think is a really interesting one, is this concept of territories. And one of the most classic ones is derm versus plastics. Now there's more oculoplastics versus plastics, facial plastics versus plastics. But the derm plastic one goes as follows. I think that each specialist does things that the other one doesn't. So, for example, all of my derm-related issues, like people ask me all the time, hey, Dr. Brown, what do you think about this mole? And, I'm a doctor. I'm a plastic surgeon. I went to med school. But the truth of the matter is that I would feel terrible, just awful, if I looked at a mole and be like, that looks fine, and it turned out to be melanoma, right? Because there are unique characteristics, and I'm not that expert.
Well versed in that.
I, for example, don't do a ton of lasers. As a matter of fact, I do no lasers. So when people say, hey, my Dr. Raban, I have this, that, the other, I said, you know what? Not my area of expertise. So I am always sending patients out to dermatologists. Dermatologists do not, nor should they ever do facelifts, eyelids, neck lifts, brow lifts, etc. They might, but they shouldn't. Just like I shouldn't be doing, some of the dermatologic things. The area that's overlap is the reason why we have a territory issue. It's called, it's the easement. It's that we do fillers, they do fillers. We do Botox, they do Botox. We do these sort of cool sculpting, all therapy things, they do it. And where you have the conflict is that there's so many people out there, and everyone is struggling. Struggling is a very, very loose term, because nobody is struggling, and that's a damn problem. Everyone's struggling to make ends meet. And so they're all worried that if I refer this patient to that plastic surgeon, she's never going to come back. And so I talked to you about it earlier. I have a very dear friend of mine who used to send me a ton of patients as a dermatologist, right? He's like, I'm sending you a patient, she needs a facelift. I'm sending you a patient, she needs her lower eyelids done. And the reason why we had such a great relationship is that when the patient would come here, they're here, right? They're sitting in my office. They're like, hey, Dr. Bond, do you also do filler? And how about some Botox? And I swear to God, I'd be like, yes, I do that stuff, but I can't do it for you. And she's like, but I just need a booster or a touch-up. Oh, there's no way. What do you mean there's no way? You need to go back to Dr. Kirby because he sent you here. Mm-hmm. And I would call him. I would literally, while the patient's in the room, I'd call him. I'd be like, hey, so-and-so's here. Da, da, da. And he'd be like, oh, thank you so much for calling me. Oh, it's totally fine. Just do her, her 10 units of Botox. It's fine. But what that demonstrated, and that's kind of where colleagues and professionals need to start to work together, would demonstrate is that I would never poach his patients. I had utmost respect. And he knew that when he would send to patients, his patients were safe here. Mm-hmm. And so I think in that regard, that's one of the major issues. The second major issue is that some specialists don't want to let go of the patients because it's financially not in their best interest. So you come in and you're 67 years old and you have a marionette, a jowl, a neck skin, right? And you need a facelift. So you get away with doing a little bit of filler with your dermatologist. And instead of your dermatologist recognizing like, hey, listen, we're at the end of the line here with the filler, buddy. Like, you're going to start looking like a balloon. I'm going to refer to you my colleague. He's amazing. He's a plastic surgeon. Or better yet, you need to go find your own plastic surgeon. They hold on to those patients and they keep pumping them and pushing the syringes. And then they look like a koi or some balloon.
Yeah. We've had this issue multiple times where, I did send a client over to, because when we talk to clients, we're talking about a lot of different issues or things that the patient might, desire. So if it's an aging patient who truly does need a facelift, and then I also send them to the dermatologist because they also needed some lasers, they needed some retexturing, or they just needed, a routine cancer check. That patient ends up leaving the office and calling me and, Dr. So-and-so, the derm, has just did a whole bunch of voluma in my cheeks, and she said I didn't need a facelift, and she said you didn't know what you were talking about.
Right.
So that is a conflict of interest for me, and it's a conversation I have to have with the dermatologist. So why would you do something like this? Is that that is not what that patient needed. She really did need the surgery.
Yeah, and I think the problem is that there's plenty to go around, right? There's, if anything, there are more patients today than ever before because there's a high level of education and awareness. So yes, there are more practitioners than ever before, but there are more patients than there are more practitioners. So in other words, the rise of patients is more than the rise of practitioners. So there's no reason for you to have to do things that are outside of your lane. You have a toolkit, you know how to use those tools. Stick to using the hammer for hitting in the nail. Don't screw in a screw with a hammer.
Right.
Right?
I do think a lot of these procedures require more of a sculptor's eye or an artist's eye, and fillers, it's a sculpting technique.
Should be a sculpting technique.
That's right, but not many people treat it as such. And so when I do educate my clients, I tell them that it should be a sculpting technique, that you really do have to understand the anatomy and how to sculpt the face with these different materials. You have to have a real good understanding of the materials and what they're doing. And I do talk to a lot of oculofacial plastic surgeons or a lot of facial plastic surgeons who just tell me, Melinda, please, when you talk to your patients, tell them not to put this in this. If they do want to do if they're looking to do a procedure such as a facial plastic surgery, facelift, or blepharoplasty, they should not have these materials in this part of the face. So, it's interesting for me to see that when I go and I talk to my plastic surgeons who will turn away a patient because they have so much in their face, or either whether it's filler or or they've had all therapy and that creates a lot of scar tissue, and it's going to compromise the surgery. and then the derm saying, no, 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 pushing these procedures or pushing these things on the patient. There's conflict of interest with what the derm and the plastic is saying and how they're educating the patient.
Yeah, and I think, again, this was where a beauty expert is a nice thing to have because you have technically, God willing, a non-biased person. The problem at the end of the day is all bias.
Right.
Is a beauty broker getting a kickback? Is the doctor making money? So you want someone to give you guidance in your best interest. I think what you said about sculpting, which was really interesting, is because it's not called sculpting material. It's called filler material. So the natural tendency is just to fill the hole. The problem, though, is that you can fill the hole 20 different ways. And if you just push volume into an area, yes, to a certain degree, it fills the area and may look better, but it can also look worse or create other deformities. So this notion of sculpting, you can't teach that in med school, right?
That's right.
You can't teach someone to have good fashion sense. You can give them money, you can give them access to an endless wardrobe at Neiman's, but you can't teach them good taste, much like you can't teach them aesthetics. And so patients always ask me, I want to go get this done. So I always tell people, if you want, if I get a call every once in a while from someone that's in another state and they can't make it to LA or they refuse to come to LA, and they always want me to know how. If someone asks me, can you take a look at this other doctor? He wants to do, I'm thinking of doing my breasts with him or something. Do you know what the first thing I do before I even go look at their breast work is?
What?
I go look at their rhinoplasties. I look at their other work because truly someone who's really artistic, there's one level, which is I'm bad at what I do. Second is I'm very good at what I do, but nothing else. And the third level is I'm very artistic. And an artistic individual, much like someone who's musically talented, is good at a lot of instruments. I'm a drummer, but I also play the guitar and the piano. And someone who's artistic you will find great results across various genres. You'll look at their tummy tucks and be like, wow, that's really nice. And then you'll go look at their noses and be like, wow, that's really nice. If someone can do a really beautiful rhinoplasty and an amazing tummy tuck, they're more inclined to be an artist than I'm really good at body contouring.
The artists are very few and far between in our industry, I have
which
to
is
say.
fine. Again, you don't necessarily need to go to an artist. You just need to go to someone who's good at the thing that you're asking them to do. But this notion of artistry, that's an internal, just like some kids are really athletic. That you're born with artistry. You learn to be good at a procedure. And the truth is you don't need to be an artist to do great tummy tucks. You just need to be good at doing tummy tucks. But if you find an artist, whether that's your derm or whether that's your plastic surgeon or whatever, hold on to them with dear life. That means that person has an incredibly keen eye. That's from within.
Mm-hmm. Regulations.
The last topic of this segment.
Okay, so who's in control and why and how do we push for stricter regulations?
So no one's in control. You're the only one in control. I've said this 1,000 times. There is no overriding watchdog. There's no one looking out for you. No one. Zero. Zilch. But what about the California Medical Board? Nope. They're not doing nothing. They're so overwhelmed, you could call them tomorrow and you wouldn't be able to get anything but a voicemail. What about the American Society of blah, blah, blah? What about the AMA? Nobody. Zero. So
why do we even have these societies?
Right.
Why is there a California State Medical Board? What are they actually doing for us?
Okay, well, so first and foremost, when you find out that your OBGYN did a tummy tuck, when your OBGYN did a breast dog, your brain should explode. What? And that's not illegal? Nope, not at all. Not at all. It's not illegal. Why? Because they have a medical license. They performed a procedure that they felt they were capable of doing it, and they did it in their own facility, in their office, where they are the medical director. So what does the AMA do? The AMA is an association that is fighting on behalf of physicians. What does the California Medical Board do? They regulate things. Yes, you can turn someone in. You can go look up your doctor at the California Medical Board. But for every infraction that they will get you on, there's 1,000 people running around looting the streets. They're just overwhelmed. These just like every other governmental program that's not efficient, not working well, they're no different. There is no one really looking for you. So you must do your homework. If you cannot muddle your way through all of that information, the Instagram, the Facebooks, the YouTube, then you need help. I mean, there's a reason, and we'll have another session on the beauty broker concept. Now, you got to be careful because they may be biased. They may be getting kickbacks. They may refer you to someone who then So I'm not saying it's by any means the right answer. I'm just telling you, you need to figure out and do the homework on your own because nobody else can do it for you. It's sad, but it's true.
Right.
I think the truth is smoke and mirrors is a reiteration and rehashing of the things that we talked about, which is that you need to be careful. And I'm sure that you have in many ways helped people get to their destinations, hopefully safer and more efficiently than they would have otherwise.
Right. We try to clear the smoke.
I love it. I love it. Thank you for tuning in to yet another episode of Plastic Surgery Uncensored. We're so lucky to have you. And refer this to all your friends. Not refer is not the right word, right? Subscribe, share, and we love for you to follow us.
We would love to get your feedback. If you enjoyed and found our podcast helpful, tell us why. Give us a review and subscribe on your favorite podcast platform. We can be found on Apple Podcasts, Google Podcasts, Spotify, iHeart, or you can go directly to revolverpodcast.com. If you have a topic you would like us to talk about, then please reach out to us on Facebook, Roddy Raban, Instagram at Dr. Roddy Raban, or RoddyRaban.com. You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.